Hello, my name is Dr. Joseph Hewitt. I'm one of the vascular specialists with Pedes Orange County in Newport Beach, California. Our goal in Pedes Orange County is to work very closely with your referring physician to bring you the best possible diagnostic tools and the most cutting-edge treatment regimens in order to provide you the best possible vascular care. Peripheral arterial disease. Many of you may have heard the term on the TV or from a friend. It's also known as PAD. What is PAD? PAD is essentially a blockage of the arteries taking blood, nutrients, and oxygen to the tissues of your legs. It's much like the hardening of the arteries that occurs in your heart when you have trouble like a heart attack. I often tell patients that PAD is like a garden hose that gets rocks in it. If you have rocks in the garden hose, the water doesn't come out the other end like it should. Why is PAD important? Well, for instance, 1 in 20 patients over the age of 50 has PAD. This raises a patient's risk of heart disease and stroke as well as heart attack. In fact, if the PAD or the blockage in the arteries in your legs gets bad enough, conditions can reach a point where you get a heart attack-like condition or a stroke-like condition in your legs. This is what we're here to prevent. When you come to our office, we need to figure out if in fact you have blockages of your arteries and how significant they are. To do this, we're going to do a very careful clinical exam on your legs. We're also going to employ some diagnostic tools to help take pictures and look at the flow in your legs. To do this, we use ultrasound. Ultrasound is a small probe that we just run up and down on your legs, taking pictures and measuring the flow. This will give us a very good idea if you have significant blockages and where they are. It'll also help us determine if we need to look into the problem in your legs further. If the ultrasound shows us that you probably have significant peripheral arterial disease in your legs, we're going to recommend that you have an angiogram to look into this problem further. What this means is that you'll arrive at our center in the morning and you'll be taken to the operating room. We're going to clean you up, give you some pain medication, and make you nice and sleepy. We're then going to put a catheter inside your arteries and inject some very safe contrast dye down your legs in the arteries. We're going to use an X-ray machine to take pictures of all of your arteries so that we get an exact idea if you have significant blockages and where they are. If we identify a significant blockage that's impeding the blood flow to your leg, we're going to take a small catheter-like device and position it in the blockage so that we can actually remove the blockage from the artery. This is going to restore the normal blood flow to your leg. Once we're done, you'll spend another 2 or 3 hours with us in our center. You'll then go home the same day. Here at Pedes Orange County, our goal is to provide you with the best possible treatment experience. To do this, we really focus on education, communication, and continuity of care. Education. Our goal is to teach you everything you need to know about the vascular condition that's affecting you and how we're going to treat it and how we're going to keep you safe while we treat it. Communication. You should feel free to call us at any time, whether before or after the procedure. Our nurses and doctors are always available to answer your questions and provide any information you need to feel more comfortable about your treatment. Continuity of care. We may provide a nurse who will come to your house before the procedure to make sure that everything is going to go according to plan with the procedure. This same nurse may also come to your home afterwards just to ensure that any follow-up treatment that's necessary is provided to you in a very effective manner. Our goal here at Pedes Orange County is to have a single-minded focus on improving the vascular health for our patients. At its most basic level, this would involve improving the quality of life for our patients, whether it means being able to go to the mall, or go for a hike, or just exercise longer. This is very meaningful for many of our patients. Some of our patients have pain due to their blockages in their arteries of their legs. For these patients, our goal is to lessen this pain and prevent it from getting any worse by opening up the blood flow. Some of our patients, unfortunately, have severe PAD, severe blockages in their arteries. For these patients, we have a very important goal, and that goal is to prevent any limb loss now and in the future. At Pedes Orange County, we're committed to bringing our patients the benefit of the best available diagnostic tools, the best treatment regimen, the best available care, as well as our vast experience treating peripheral arterial disease. We have the skills, the dedication, and the commitment necessary to get all of our patients back on their feet and make sure that they stay there.